Hey, it's always a pleasure to have you. My name is Dr. Nema Lema and welcome to Autism and Beyond YouTube channel. Today we're going to talk about speech therapy in reference to speech delay. How do we make sure that our children on the spectrum have high successful rate when it comes to speech therapy? So one thing I need to bring into your attention is the fact that a third of our children on the spectrum are non-speaking, okay? So this has nothing to do with them being on speech therapy or not. It's simply because based on how their language development, they do not have the capacity to vocalize words, okay? They will be communicating but not using words, all right? Now, for the remaining 70%, which is 7 out of 10 children who are on the spectrum, they'll be developing language differently. And I did a video on how language develops in children who are on the spectrum, and I'm going to tag it on the comment section, but it should be appearing here. You can go watch it after you're done with this video, okay? So 7 out of these 10 children, so there are those ones who go into full maturation of language, and they'll be able to really speak just like any other typical person, okay? But then there are others who just have functional language. Functional language is when when you ask them something, they'll be able to respond. When they need something, they'll be able to ask, but they'll not be able to be involved in most of these chatty conversations, flowery conversations. But if you want to get details from them, you need to ask for details, all right? So what you ask is what you get, period, okay? So that's what we call functional language. So now, when it comes to speech therapy, these are the people who can benefit from speech therapy. For them to be able to get at different stages of their language development, then speech therapy really comes in handy. So how do we make sure that speech therapy is a success for our children who are on the spectrum and they also have speech delays? The first thing is, of course, you need to confirm that they can actually hear. And we always say all children who have delayed speech must do a hearing test to confirm that they can actually hear everything in a conversation. Then the second thing, you make sure, of course, their nutritional levels are good, like everything is fine. And I did a video on the common deficiencies associated with autism, and it's built simply because eating for them can be a challenge as well. Again, I'm going to tag it on the comment section. And of course, we need these kids to be interacting with other kids. Yes, they're on the spectrum. Yes, their social interactions are challenges. Their communication is a challenge, but they need to play with other children. Yes, please, as a parent, make it very intentional that your child is exposed to typical children. It's extremely important for their brain development, okay? Then once you have done all this, you have to also make sure that before you enroll your child on this speech therapy, they must have attention, a good attention span, okay? A typical child who is a toddler will have an attention span between 4 to 8 minutes. That's a 2 to 4 year old. They'll have an attention span of between 4 to 8 minutes, okay? So if your child is somewhere there, then when it comes to speech therapy, they have to pay some level of attention for them to be able to learn words. Okay, and that's why play becomes very important, because most of our children on the spectrum, as long as whatever they're being shown is interesting, they'll pay some level of attention. And of course, for a child, nothing is as exciting as play. All right, so that's the first thing. The second thing is joint attention. Joint attention is when two people, that means the therapist and this child, can actually focus on one thing. So we say a child has joint attention when I'm talking about a ball, this child can actually look at this ball and look at me pronouncing the word ball and be able to connect. That's what we mean by joint attention. And of course, the therapist must be exciting and also playful to make this child also find this process interesting for them to be able to pay attention. Then the third thing is they should be able to understand simple gestures, things like come, go, mama, eat. Like if someone shouts mama in the room, they should be able to turn and see, oh, where is mama, or a ball, or, you know, if I am able to say come using gestures, come, then they should be able to understand I'm actually saying come, okay? Then the fourth thing is they should be able to pay some simple instructions. So follow some simple instructions. Things like go, they should be able to say go. If I smile at them, can they be able to smile at me? If I point at something, are they looking at it? Okay, so these simple instructions have the fact they're able to follow simple instructions. These things have to be there before you consider speech therapy. Then the fifth thing, they should be vocalizing some sounds from their mouth. Now, as we said, a third of our children on the spectrum will be non-speaking, like they are mute. Okay, but if you are going to consider speech therapy, then these children must be vocalizing, okay, some sounds, and these sounds have to be intentional. So when this child is mad, for instance, then you'll be able to know when they are mad, when they are happy, when they're excited. Usually the way the sounds they make from their mouth is usually different. Even if it's purely gibberish, there's a difference of sounds when they're happy, when they're excited, when they're sad, when they're complaining. If you're keen enough and paying attention, you'll be able to pick all of these, all right? And then the sixth thing is the fact that they should be able to be imitating. Usually the first thing to imitate is the actions. So if I'm dancing, are they able to follow the dance? Just simple, even if it's just doing this. Are they be able to follow simple actions? Are they be able to follow simple gestures? So if I'm saying bye-bye, are they able to wave back bye-bye, okay? Because usually imitation starts with the actions, then gestures, and then words. So as we know, speech therapy is imitating words, making sense of, the pronunciation and being able to relate whatever I'm saying to the circumstance, okay? So if they are not able to imitate, then you know that speech therapy will be difficult. And of course, that means the success rate will not be as good, all right? So I really hope this helps someone. And if you're considering your child to start speech therapy, make sure these things are there and you're following them through. However, this is what I can tell you. As a parent and also as a pediatrician, nothing beats exposing your child to other kids through play. Allow your child to interact through play. Play is just like magic. I think there's a reason why children are supposed to play. It's a must, it's a mandatory, because they learn a lot. The best teacher of another child is actually another child. The best teacher of a child is actually another child, okay? So if you want your child to talk, if you want your child to learn how to interact socially, if you want your child to learn how to, solve their own conflicts, if you want your child to learn how to build friendships, if you want your child to have emotional intelligence, the best thing is expose them to other children and let them interact, okay? So that brings me to a close, and I hope you found this helpful. Remember, all the videos I've mentioned, I'm going to tag them on the comment section. Until then, bye-bye and God bless you.